I don't really think of the future the same way as I did before. I just sort of have accepted that there might not be as much future as I want there to be. When you're faced with mortality, you've come to terms with the fact that there might not be tomorrow or next week or next year. My name is Allie Vreeland. I was diagnosed in February 2015. I was 27. Christmas, put lotion on, felt like a lump. I am BRCA positive. You know, it's probably nothing. Ultrasound, biopsy. My doctor called me in to tell me that it was breast cancer. Invasive breast cancer, estrogen positive, HER2 negative.
Breast cancer descriptive analysis. Breast cancer is a disease in which cells in the breast grow out of control. Breasts are milk-secreting organs. They are made up of lobules, ducts, and connective tissues. Breast cancer usually develops in the lobules and ducts of the breast. Breast cancer can also invade other tissues, metastasized via blood and lymphatic vessels. Different people have different symptoms of breast cancer. Some may appear as asymptomatic. To diagnose breast cancer, patients may undergo several screening processes such as mammography, ultrasonography, mammography, and biopsy. Standard treatment options for patients with breast cancer are surgery, radiation, hormone therapy, chemotherapy, and targeted therapy. Breast cancer does occur in men, but the cases are quite rare. Signs and symptoms of male breast cancer may appear as lump, nipple discharge, reddening, nipple inversion, and skin dimpling. Incidence and prevalence of breast cancer in worldwide population. There are about 2 million new cases of breast cancer diagnosed in 2018, and it constitutes 11.6% of all cancer and 6.6% mortality rate. 24.2% out of all cancers among women are breast cancers, and it constitutes 1 in 4 women diagnosed with cancer. Less than 1% of all breast cancers occurred in men in the United States, and the trends of incidence and mortality are depicted as in the diagram. Incidence and prevalence of breast cancer in Malaysia. There are about 7,953 newly cases of breast cancer diagnosed among women in 2018, and it constitutes 32.7% of all cancers in women and 11% mortality rate. In the 4th-year prevalence, Malaysia have 24,021 female breast cancer patients, and breast cancer become the second leading cause of cancer death.
Descriptive epidemiology analysis describe the data distributions of diseases and their determinants in terms of person, place, and time. Globally, the characteristic of the risk population of breast cancer, it has a high prevalence in females, but only less than 1% of all new cases happen in men. This is the breast cancer data from Global Burden of Disease (GBD), the study from 1990 to 2017 in 195 countries. Table 1, the data showed an increasing trend in males and females cases between 1990 to 2017. In 2017, the female cases reached out to 1 million cases. The second characteristic of the risk population is the age. Globally, the breast cancer incidence in the 50 to 69-year age group was the highest among the 3 age groups. Based on Figure 1 graphs, the proportion of the elderly breast cancer incident cases was the largest in the high social demographics index quintile and the smallest in the low SDI quintile. The characteristic of the risk population we look into is the socio-demographic. Socio-demographic index (SDI) is a summary measure of geography's socio-demographic development. Based on Figure 3, the number of breast cancer incident cases increased in all SDI quintiles, and it is precipitously increased in middle SDI and low middle SDI countries. Based on Figure 3, the breast cancer incidence in social demographic index pattern can be observed: high, high middle, low middle, and low SDI quintile. The fourth characteristic of the risk population we can look into is the place. Globally, the largest increases is in North Africa, with lowest increases such as in North America. These data were accepted from WHO Choice database in regards to the total cost per patient for every stages in the breast cancer. From Table 1, China, USA, and India were the countries with highest new cases in 2017, while Marshall Islands, Greenland, and Kiribati were the countries with the least. In the study, the cost of each interventions for breast cancer were evaluated in Africa, North America, and Asia. The costs were calculated in US dollars. There are two types of costs for health services. The first one is the patient-level cost, which included the resource use such as initial evaluation screening like mammogram. Second types of cost for health services is the program-level cost. The range in the total cost per intervention of the 10-year period was considerable. For example, based on Table 3, the total cost for stage 1 treatment was $68 million in Africa, about $3,000 million in North America, and $143 million in Asia.